Outcome trials in type 2 diabetic patients. This is my disclosure slide, and then I will show you the overview of my talk. So I will first introduce you to the mechanism of action and the motivation why GLP-1 receptor agonists and DPP-4 inhibitors have been developed for the treatment of type 2 diabetes. And as you will learn, they were meant to be glucose-lowering agents. But soon it was discovered that they could not only act on the endocrine pancreas, but rather have cardiovascular effects shown in animal studies and mechanistic human studies. And so the idea arose that maybe they can be helpful to prevent or treat cardiovascular disease in patients with type 2 diabetes as well. Eventually, but not voluntarily, these cardiovascular outcomes trials had to be performed because this is a rule since 2008 that any new agent to treat type 2 diabetes, according to the FDA, has to be tested for cardiovascular safety, and this requires very large-scale clinical trials exposing frail patients at risk for cardiovascular events to those agents. And they have shown a number of interesting results that I'm sure you know about, but I will try to focus on some details that may be important for our future choices of agents to be prescribed to patients with type 2 diabetes. So here I'm demonstrating a little bit of history, and that is from Jens Holster's publication in the year 1987, so now more than 30 years ago. And what he really did, he found out that the GLP-1 that is the real biological substance produced in the gut is not GLP-1 to 36-amide, but that you have to truncate it by 6 amino acids in order to get the bioactive version. And if you use that, then concentrations as low as 10 to the minus 10th molar were effective in stimulating insulin secretion in the isolated perfused pig pancreas. And we were interested in GLP-1, and gladly I knew Jens Holst, so he was willing to cooperate in these studies. And so we took synthetic GLP-1, exactly of that sequence, 7 to 36-amide, and infused it to the patient. You may see the infusion line on the arm of this patient. And my doctoral student, Nicola Kleine, she sadly died last year because of a brain tumor, but she was the first one to really see blood sugar coming down from an initial value of around 260 milligrams per deciliter. 4 hours later, it was 95 milligrams per deciliter. And we did a series of those studies, and the uniform finding was, as shown in red, you